All right, Dr. Simpson, thanks so much for being on the Friends with Wheels podcast. My first question that I have for you is tell the audience a little bit about you and how you started.
Yeah, so I'm Dr. Courtney Simpson. I currently direct the Eating Disorder Treatment Center at the Evidence-Based Treatment Centers of Seattle. And we specialize in providing evidence-based care for folks with eating disorders. So I've been in the field of psychology for about going on 13 years now and have spent all of that career focusing specifically on eating disorder treatment. And I'm really passionate within that about dialectical behavioral therapy for folks with eating disorders and complex comorbidities. And how I got in that is that I had an eating disorder myself. And that was something that I struggled with for a long time and received treatment for, and found that, I could hopefully use my experience to help others. And DBT specifically is what I found really helpful during my time in treatment. And so that has really fueled my career.
So how does DBT and eating disorders kind of like go together?
Yeah, great question. So, dialectical behavioral therapy is really focused on targeting individuals that have difficulties regulating their emotions. And when I think of eating disorders and how I conceptualize and understand them, is that folks actually turn to food to regulate their emotions. And so, using food to cope with big emotions, uncomfortable emotions, when when they're having a hard time. And what we find is initially when folks turn to food to help regulating their emotions, it works. It's reinforced. It's effective, right? And
Hmm.
so people continue to engage in disordered eating behaviors to help regulate their emotions when they're in distress. And it's reinforced temporarily. What happens though is that over time, the behaviors become less effective and they interfere with folks' long term goals and values. And so DBT comes in and focuses on giving people specific tools, strategies, skills to target the emotions that they struggle with and replace the disordered eating behaviors with more effective ones that don't harm their health and help them achieve the goals that they want for themselves in their life.
hmm And so what are more effective eating strategies to sort of get them out of the habit of eating, as a way of sort of coping with their regulating their emotions?
Yeah, I love that you asked that question. So, DBT has four modules. So, in addition to individual therapy, a big component of DBT is skills training. And so, there's four kind of components that we go over in skills training. It's mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. And each of those modules has a ton of very specific skills to help folks regulate their emotions based on the emotion they're experiencing, the intensity of the emotion, the duration of the emotion, and all the different contextual or environmental factors that might be complicating an emotion as well. And so it's not just one specific strategy or two specific strategies, it's hundreds actually that people then can experiment with and pick and choose which ones work for them to replace their disordered eating behaviors and regulate their emotions in a way that's not harmful, effective, and consistent with their values.
hmm And so let's say someone with an eating disorder comes into your office and says, I'm struggling with this eating disorder, blah, blah, blah. And I've been, trying all these different strategies that you prescribed me to do, but they're not working. What would you do in that case?
I mean, that's something that I encounter frequently. So, what's hard is that all of the DBT skills, research supports they're effective. I know they're effective. I've seen them in my life, my friends' lives, my patients' lives. And yet, the challenge with implementing them is that it's not easy, right? Change is hard. And so I never expect someone to learn a skill and then be able to use it forevermore and not struggle and not have a hard time. So there's a lot of problem solving then that comes in. I'll teach someone a skill and I'll say, let's experiment with it. Let's try. Most of the time, it's doesn't always work the best initially. And so there's a lot of problem solving, refinement that I work on with folks to identify, okay, what's getting in the way of the skill use and the skill use being effective. There's a variety of different things that come in the way. So again, we do a lot of problem solving. We do some deep dives into certain behaviors using something called a behavioral chain analysis, which is a sequential method for identifying all of the different things that lead up to a target behavior like an eating disorder. And then we identify kind of where in that chain, where in that sequence can we do something different next time? And how can we set you up for success next time as well? How, let's practice the skill in session together. So there's some practice that we can do to increase generalization outside of the room.
Hmm. And what have you learned in doing this kind of work?
Yeah, I mean, what have I learned? Oh gosh, that's a big question. I've learned a lot. Um, I think, I think the biggest thing that I have learned, I guess I kind of knew going into the field, but I, what I would really want other people to understand is that eating disorders are not a disorder of vanity. They're not just about the food. And they're really complex mental illnesses that have strong biological components. And there are a lot of neurobiological reasons that folks are more likely to develop an eating disorder. And that's what makes it really hard, is because the neural pathways have been developed and strengthened to reinforce these eating disorder behaviors. And so that change is really challenging. And so often, folks are frustrated with the loved ones in their life because someone has an eating disorder and they just won't eat, or they're just so vain and all they care about is being thin. And what I find is those are the ways in which that people kind of like communicate the disorder outwardly, because they don't always have the knowledge or words to label what's actually happening for them internally. And so it's not just about the food, it's not just about control, and it's absolutely not about vanity. It's about biology. And that's what's make change so hard. And so I really, the stigma, the stereotypes that exist around eating disorders are wildly inaccurate and oftentimes present as barriers to treatment and help seeking. And so that's something that has been solidified more and more throughout my career, is the biological bases of an eating disorder and how the common perceptions of what contributes to them, their underlying mechanisms, are very inaccurate. And so it's really targeting um, the underlying mechanisms through um, through learning new behaviors and then replacing those new behaviors with problematic behaviors. And it's hard. It's really hard, especially I think in our environment where sometimes, talking about our emotions, feeling our emotions is not something that is seen as like good. That's a judgment, but like it's not something that's like welcomed or reinforced. And so, we talk, it's pretty more normalized to like suppress your emotions, put them down. And, I wholeheartedly believe that eating disorders are disorders of emotion regulation. And the more that we actually give people the language to talk about their emotions accurately, to label them, name them, describe them, the more that they're going to be able to then help identify what to do that's actually going to be beneficial for them in the long term. So I think really what I've learned and solidified is the biological bases that's so strong for eating disorders. And I think the other thing too, kind of relatedly, is that eating disorders don't come in one shape or size or race or ethnicity or gender or sex. Eating disorders are prevalent in everyone, truly. And yet so many folks don't present to treatment because they don't fit the stereotype of what someone with an eating disorder looks like. And so I think that that's a huge bummer. And I would really love to continue to provide education for folks and help folks understand how you can't look at someone and identify whether they have an eating disorder at all. Um, and it's way more complex than that. And so, yeah. feel like I rambled a lot, but
No, that's okay. That pretty much sums it up. What I was going to ask is, you touched a little bit on it, which is the stigma around eating disorders. I know that like in a lot of media and TV shows, that there's a lot of sort of shows or movies that sort of depict eating disorders. And because I remember talking to this mental health therapist in Los Angeles, and she told me that she watches a lot of reality TV shows, she watches a lot of movies. And lately she told me she was watching The Pit, which is a TV show about mental health and all that stuff. So, with eating disorders, is there any sort of TV show, movie, uh, anything really in the media that encapsulates that big issue around eating disorders?
oh, I wish I had a good offering for you. There's definitely been some efforts over the years to present eating disorders in a little bit of a different light, but I wouldn't say that in the media it's ever fully accurate, and there's always something that is flawed. I think that, you mentioned the pit, and I know I was really excited to see that portrayal of someone with an eating disorder on the pit, and I think the way it was presented too was pretty consistent with, I think, why people oftentimes don't receive the care or don't even really understand what they're struggling with because they don't see models of themselves in the stereotypical presentations of an eating disorder. And so when we think about the pit, right, it was an older woman that was Black, and that doesn't meet the stereotypical, appearance of someone with an eating disorder, right? We think of like a young white woman. And so I think that the pit did a good job of just providing a little bit of data to suggest that, hey, eating disorders can look different, right? It's not a one size fits all at all. And so I don't think that I have a good recommendation for like media. I will say that the National Eating Disorders Association has done some good campaigns over the years talking about how eating disorders don't discriminate, and focusing on, men and eating disorders, and eating disorders in individuals of different races and ethnicities. And so, if there was one place that I would refer people to kind of get more information on that, I would recommend the NEDA website, or the National Eating Disorder Association.
Hmm. And was there some sort of a mentor that you looked up to that said, "I want to get learn about eating disorders"?
Um, that's a great question. I think so. There were definitely people like when I was in my own journey of treatment and recovery, I had a variety of different therapists that I worked with that I looked up to and that also had disclosed their struggle with an eating disorder. And so I kind of looked to them and was like, okay, they've used this experience to help others, and I want to do the same. Going into grad school and getting a PhD, you have to apply to work with a specific advisor or mentor. And you apply to a school, but it's really a focus of like finding a mentor that matches you. And then going where you're accepted. My graduate school mentor was Dr. Suzanne Mazzio in Virginia, and she studied disordered eating and eating related interventions. And so obviously in grad school, she was my primary mentor, got a lot of supervision and support from her. Specifically around like research on eating disorders and eating disorder treatment methodologies. Since then, I did my pre-doctoral and postdoctoral training at UCSD Eating Disorder Center for Treatment and Research in San Diego. And I worked with some amazing clinicians that were mentors for my learning in treating eating disorders using DBT specifically. And so got some exceptional training and supervision there. And I'm so very grateful for that experience in terms of learning how to take DBT and use it for folks with eating disorders specifically. And now, in my current role at the Evidence-Based Treatment Center of Seattle, or EBTCS, my boss is the founder and executive director of the whole clinic, and Dr. Jen Sayers, and she was Marsha Linehan's postdoc and worked with Marsha for a long time. And Marsha's the developer of DBT. So
Hmm.
Working with Jen, she has a lot of knowledge and experience in DBT specifically. And so I've really been grateful to be able to work alongside of her and learn from her experience, working directly with Marcia. So I've had a lot of really cool mentors, supervisors throughout the course of my career that I feel very thankful for.
Hmm. And, do you have any tips or advice that you want to give to those who want to study eating disorders?
That want to study eating disorders.
Or
Tips, I
like,
think,
or like do what you're doing now, like in your
yeah.
role. Yeah.
I think the thing, it's hard to get like initial clinical experience with eating disorders because they tend to be polarizing. The thing with eating disorders that is different from a lot of other mental health concerns is that they are associated with um, significant medical complications. And eating disorders, I believe, at this point, are the second highest risk in terms of mental illness for death, and second to the opioid epidemic. And so I think it's like somebody every minute in the United States dies from an eating disorder. And so there's a lot of medical complexity that makes people not want to touch eating disorders. So people either, in my experience, clinicians either like work with eating disorders or they don't. There's not a lot of like middle path there. And I think because of the fear of the medical complexity. And so that can kind of make it challenging to get into. And yet, I think the really important thing about doing eating disorder work is working with a team. So, I work collaboratively with doctors, psychiatrists, nutritionists to help provide some of the guidance in the medical complexity that where I don't have knowledge, right? Or I don't have expertise. And so I think that's really important. So that's one thing to think about. And the other thing is a lot of times people see eating disorders even beyond the medical complexity is just really challenging, because people won't just eat their food. And, you know, so many people are like, oh, wow, you work with eating disorders. And it's interesting because I'm like, I love it. And they are very challenging disorders to treat. And we don't have great evidence-based interventions for them. That is true. And yet, folks with eating disorders tend to be some of the smartest individuals that I know. And it's really about meeting with them where they're at and helping them identify why their behaviors are inconsistent with the goals that they have for themselves. So I guess like the scariness around medical complexity, make sure you work with a team, and the fears around eating disorders or the idea that, they're just too much, they don't want to get better is inaccurate. These are biologically based illnesses, and you have to work with your patients to help them learn new behaviors and strengthen new neural pathways. And it just takes a while. So it
Hmm.
does require patience.
Yeah. So, my next question is, how do you go about educating the public around eating disorders? Because you talked a little bit about the stigma that's going on with that. So, how do you sort of educate the public about, what is an eating disorder? How do you go about it, et cetera, et cetera?
Yeah, I mean, I think the the first thing that I often do is talk about the stigmas associated with it and how they're inaccurate. So I think the two things that I frequently talk about with eating disorders I've mentioned, which is focusing on one, that they're biologically based illnesses and they're not, because someone's vain or self-focused or selfish, like I hear all the time. That's absolutely not the case. And two, that eating disorders don't discriminate, that anyone and everyone can develop an eating disorder. It doesn't matter shape, size, religion, gender, sex, race, ethnicity. And so I think those are like probably the 2 points that I really try to educate others on to decrease or to challenge any current stereotypes that people might have and um, be open to, I think it can just help with increasing understanding and validation.
Hmm. And for those who want to learn more about your work, what can they do?
Yeah. So, like I said, I work at the Evidence-Based Treatment Center of Seattle. And so looking me up on the website, we have a whole eating disorders team there. And so you can go to our website, learn more about us. We're in the process of updating our website. We should have a new website launching soon. And I've written a couple drafts for blogs that will be posted on eating disorders specifically, kind of breaking some of these things down that we've talked about. So hopefully there's more to come there too.
Yeah, I'll make sure to put it in the show notes once the new website is up and running.
Yeah, well, we have a current website. It's just that we are working on updating. Well, we'll be launching a new one soon, and there'll be even more content on there. So,
All
yeah.
right. On that note, okay.